Hello, my name is Noelle Haller and I'm a third-year undergraduate athletic training student at the University of South Carolina, and today I'll be discussing with you magnetic resonance imaging, otherwise known as MRIs. MRIs are a type of diagnostic imaging that apply a magnetic field to the body and produce signals from the body via radio waves to the computer, where we are able to analyze that data and produce an image of what we are trying to look at as far as injury goes. With that, we are able to identify tumors, fractures, musculoskeletal injuries, soft tissue injuries, as well as any sort of bleeding that might be occurring. It takes roughly 30 minutes to an hour for this process to be complete. And there is a contrast dye available that is injected via an IV, where we are able to better differentiate between the organ structures as well as the soft tissue structures and kind of see where the damage lies within those. And with that being said, fat is going to most often appear dark on these scans, while any sort of bleeding or cerebrospinal fluid or edema is going to appear white. And with that, there are some contraindications that go along with this diagnostic imaging. That would be if you are pregnant, if you have any sort of metal implants, if you recently had a cochlear implant done, any heart surgery, stent that might have been placed, and as well as if you're claustrophobic. And if you are claustrophobic, you can always request an open MRI if that is available. And if it is not, they will likely put you under sedation to make you feel as comfortable as possible for this whole process. With that being said, this is what an MRI machine typically looks like. You will lay down on the table and you will be inserted in and stay as still as possible. You may or may not have headphones on so that they can speak to you during this process. And next we have several slices of an MRI of the knee to kind of get an idea of what that looks like.